Anne Hosford, Clinic Director of Barbados Fertility Centre and also a nurse. Today I'm going to explain to you what tests you need and medications you need for IVF. So there's a list of tests that you need to do in vitro fertilization. There's infectious screening for yourself and your partner, HIV, hepatitis B and C. Of course, there's ovarian hormones. We need to see how your ovaries are working. That's really important because it also determines, along with your medical history, what dose of fertility medications you need to stimulate your ovaries to produce eggs. We do a thyroid hormone, we do prolactin hormone. They're really important because they can interfere with implantation if they're not within the normal range. So we'll check for those. Easy blood tests to do. We do some antibody screening, check to see if there's anything in your bloodstream that's attacking embryos that are trying to implant. And especially for women with recurrent miscarriages, we will do some detailed immune blood tests also. Of course, blood is fantastic, but we also have to see the womb cavity itself. Where are the embryos going into? Is the womb normal? Are the ovaries normal? What sizes they are? What sort of preantral follicle count you have? So this is a more invasive test. It can be done with your gynecologist. Obviously it can be done here, but most people have it done in their home country. It's a good detailed screening test of the ovaries in the womb so that we know exactly when we place your embryos back the quality of the endometrial tissue that we're putting it into. So once you've done all the tests, of course for the male we have to do a semen analysis. That's very important to see what sperm we're working with. Just like checking the ovarian hormones and what kind of quality the eggs are, it's the same with the sperm. Remembering that sperm and eggs are both gametes, which are basic cell tissues, so we'll be looking at both in detail. The male partner also needs to do HIV, Hep B and C, but again, an easy blood test to do. We can even do it with your primary care doctor or your GP. Once all these blood and investigation screenings are complete, what you'll do is you'll either scan and email them to us, or your doctor will fax us a copy, or indeed you can collect copies and fax it to us or email it to us yourself. Remembering that it's important to keep copies of all your own test results, so as you go along, do ask for copies from your doctor. That's really important. So that's the screening that you need. Based on these tests, we'll determine what medications you need for your IVF. And again, this is very important because everybody's protocol is individual. You are different from all the other women you talk to, so just because they're on one thing, it doesn't mean that you are on the same thing. That's really important to realize, is that your protocol at Barbados Fertility Centre will be individualized. So we look at the antibody results. Do you need any implantation regime medications? We look at your ovarian hormones, what sort of quantity of stimulating medications you will need. The same with the hormones for the prolactin, TSH. Do you need any medication to normalize those? Once the doctor has looked at your blood results and has determined what medication you need, we will then organize your medications with you.